In addition to the outpouring of support from high-level members of the public, ordinary Americans continue to support President Trump. Crowds have been gathering outside of Walter Reed National Military Medical Center since Mr. Trump's arrival, many of them praying for a swift recovery. Joining us to talk more about the president's condition is internal medicine specialist and immunologist Dr. Neeta Ogden. Dr. Ogden, thank you for joining us. President Trump's doctor said specifically that the president is not currently on oxygen, but that he wouldn't be nailed down when asked if the president had been on oxygen at any point. What does all of that say to you as a medical expert?
Good morning. I felt that Dr. Connolly was evasive, especially about the issue of oxygenation. To me, it's obvious that they probably had him on supplemental oxygen at some point earlier. Of course, not right now, which is what he kept saying. We also know that remdesivir, which he received when it's been studied, was most effective in patients who were in the hospital and receiving supplemental oxygen. I'm beginning to feel that the president falls into that category, especially since the doctor was pointedly asked so many times and clearly was evading the question. They're trying to not give out any negative data. So you could see that he didn't comment on fever, but he did share the most recent oxygenation of 96%. He did, try to only highlight those positives, that the normal heart rate. He shared his systolic blood pressure. So he really was, cherry picking what kind of information he was going to share with us.
Yeah, and I also want to pass along information from the White House pool. It's on background from a source familiar with the president's health, saying that the president's vitals over the last 24 hours were very concerning, and the next 48 hours will be critical. I want to know more about what you have learned about the president's symptoms and the treatment that he's receiving for them.
Yeah, from the get-go, I was concerned when first we heard that he had a positive test, and then very quickly it accelerated into congestion, cough, fatigue. We started hearing about breathing problems, which of course the doctor denied as well, that he didn't have any issues with breathing. But the reality is when you hear about those symptoms, it's obvious that this is not just a mild infection. He's at the hospital. Now he's receiving 2 experimental therapies as well. I feel like he was probably moving in the direction of somebody who's looking sick. And especially since they're throwing all these therapies at him, basically everything that sort of had some data behind it, in addition to the vitamin D, the zinc, the melatonin, he was getting everything. And I think they were concerned. I really do think they were concerned when we're hearing that his vitals were stable now. But, of course, we don't know. What was his oxygenation before he went to Walter Reed, when he was at the White House? There's probably more alarming statistics behind all of this that they just haven't shared.
Now, tell us more about how the president's age, his gender, his overall health might play into his prognosis.
Yeah, so he has a lot of risk factors for severe disease. One, he's a man. We know that they fare worse. He's 74. People who are over age 65 had a higher mortality. When we look at the data since March, have a higher mortality rate. He's also, people say borderline obese. He's obese. And they haven't been very forthcoming, the White House, about his other medical conditions. People suspect that he may have high cholesterol. He had a strange secretive visit to Walter Reed last year. I mean, some people believe that maybe he has more significant heart, issues than they claim. So there are things in his medical history that definitely put him at higher risk. And when I started hearing about the acceleration of these symptoms, it really did make me think that, there could be risk factors here that we just don't know enough about that could explain why he is accelerating so quickly and could actually take a downturn still in terms of his symptoms.
Yeah, I do want to make sure, though, that our viewers are very clear that the report from the president's physicians are that he is doing very well at this moment and that he is only at Walter Reed Hospital out of what the White House calls, excuse me, an abundance of caution. Nonetheless, we do know that the coronavirus can turn very suddenly. What is it that the medical physicians would be looking for, the indications that a patient is doing well or is potentially more concerning when you're at this stage, roughly 72 hours in?
Yeah, exactly. And so it really remains to see how we can see this progression of events in terms of symptoms through day 7 and day 10. And that's what they're really looking for. His breathing in particular is something to be concerned about, because we've heard stories of even young people leaving the hospital and being discharged because they had mild symptoms and then quickly returning and needing to be on a ventilator. So definitely his breathing. We don't know any information about his chest X-ray. So, that's something of concern. Increasing evidence coming out that COVID has a strong effect on the heart and can cause a myocarditis or an inflammation of the heart. Now, especially if President Trump has a history of high cholesterol, any issue with blood pressure, that puts him at higher risk of having symptoms. So again, even in young people, we've seen they look okay. And then within a matter of those days, this coming week or those days, when we see a downturn in events that can involve the heart and people with actually even no prior history, people who were athletes. So the heart and the lungs are two of the really big, organ systems that we're concerned about. And then there's this other second phase of COVID, which we all hear about as sort of that overactive immune system. So now it's no longer the virus, but it's our body creating an extreme reaction. The cytokine storm is one of those things that you keep hearing about as well. And that's another thing to keep an eye out. Is this something that, in certain people we see, depending on their viral load and other parameters, can they have a more robust immune response that then can lead to more severe consequences in the later days of the disease?
All right, Dr. Neeta Ogden, thank you.
Thank you.